tonight Dr. Wygold. It is my honor to introduce him. Dr. Wygold is a board-certified psychiatrist who's been in Riverside County for 14 years. Man, that's a long time. Working with Dr. Wygold makes it seem like it's been much, much longer. He's worked at our county as a psychiatrist, at the hospital, at ITF, and many of our outpatient clinics, including New Life, KFSP, and the county HIV clinic, and also Blaine, Banning, Corona, Hemet, and other clinics. That makes it seem like nobody wants it, right? He's now working with one of our very innovative programs called Mobile Psychiatric Services. Although the service is mobile, it is not the same as our mobile response team. MPS is not a crisis service. If you want, we can schedule a later meeting just to discuss what all our services in crisis support system of care. Like I said, MPS is not a crisis service. It is an ongoing outpatient behavioral health services that prioritizes those consumers who have been needing an excessive number of crisis services in recent months. The cycle in and out of the hospital, frequent visits, frequent hospitalizations. MPS takes clinic services to your loved one until the situation can be stabilized enough that your loved one can again start using a regular clinic. Our homeless population with many different hits in the hospital without needing excessive crisis services. If Dr. Wygold ever does decide to leave us, it probably won't be until after this building has crumbled to dust. Oh, by the way, he did go to school, so we'll cover that. The boring stuff. He graduated from Texas A&M University with a degree in psychology, med school at Michigan State University, and psychiatry residency at the University of New Mexico. Well, if that ain't enough, he's definitely certified to be here tonight.
Or certifiable. So, tonight we've got a couple different things, several different presenters. My first opportunity is to introduce Dr. Monica Tone. She joined us in January as the Associate Medical Director for our Substance Abuse Prevention and Treatment Programs, and also as the Associate Program Director for the Psychiatry Residency, training our next generation of psychiatrists. She went to Loma Linda School of Medicine. She has psychiatry residency at Case Western in Cleveland, and 2 different fellowships, one in addiction psychiatry and one in public and community psychiatry. She's smart, funny, with a wonderful family that she needs to get home to, which is why I'm doing this up front, which includes 2 small boys. But I have to warn you about something. She's Canadian. Sorry, I didn't get to choose. Okay, so let me turn it over for just a minute to Dr. Tone so that she can tell you about her new role in our county.
Thank you, Dr. Wygold. Hi, everyone. So I just joined the county in January, so I'm new to the county and very excited to be here. As Dr. Wygold said, I'm with the Substance Abuse Prevention and Treatment Program. So my background is working with addictions, and in the past I've worked inpatient and outpatient. Here I'm primarily working to expand our medication for addiction treatment program. So that's medications like Suboxone and Vivitrol, life-saving medications for addiction. So we're looking at trying to get as many people connected with these services, as well as treating the mental health component of addictions too. So because of addiction psychiatrist, I focus on both, and the mental health is a huge part of recovery. So I've been working with the SAPT program and gradually trying to increase our services there. And we're also working with the rest of the county in projects like trying to increase the use of MAT in detention and those types of settings. So I'm really excited to be here. I think there's lots of good work to be done and great people to work with, like Dr. Wygold. So I'll turn it back over to you, and thank you for allowing me to be here and introduce myself.
Good evening, everybody. How is everybody doing? Good. My name is Willard Wynn, and I am the new program manager for Family Advocate Program. Thank you. Thank you, Dr. Tone, for taking the time out of your busy schedule to join us. We really appreciate you. So, Family Advocate Program, we are doing these presentations to inform our community, right? It's very important that we keep our communities informed and our families locked in. So the only way that we can get better at what we're doing is staying locked into each other and learning new techniques. So I'm so glad that the medical staff has been here. It kind of solidifies what we're doing as a program. So moving forward, I have Alicia Mosillo is going to come up and she's going to introduce our first speaker. Alicia.
Good evening, everyone. As Will said, my name is Alicia Mosillo. I'm the Senior Family Advocate out in the Mid-County region. And one of the main reasons why I came today was because Christina, who is sitting right here on my left, is a family member that I've been working with for quite some time now. We worked together with one of our liaisons. His name is Aurelio Sanchez. He is our veteran. He couldn't be here tonight. He really wanted to be here today, but he wasn't able to. But we worked together with this family in trying to help her son that was having challenges with mental health and addiction. One important factor that I just wanted to mention is that sometimes it's really hard for us to be able to help our families when they're not connected into services. And when Christina came to us, she came through a CBAT referral. CBAT is our crisis teams, the ones that are out in the community working with law enforcement. They had multiple contacts with her son, and they reached out to me and asked if I can please connect with this family and try to help them out. At the time though, because her son was not connected to mental health or any of our programs, it becomes a little bit hard for us, right, to be able to reach out. I'm sure you've all heard this, well, as long as it's not voluntary, you know, if he doesn't willingly come in, there's not much we can do, right? You've heard that. So we kind of worked a little bit out of the box in this particular situation because we knew the need and we knew that law enforcement was really on this in terms of helping this gentleman, this young man. They saw the need in him, they knew his history, and they were like just pleading, like, please help him out. So we were able to set up a home visit with Miss Christina and her son. At one point with Aurelio Sanchez, again, our veterans liaison, and that's how we began our journey with this family. So I just want to introduce to you Miss Christina, that so gracefully, I know this is going to be hard for her, but we're all here to support her, which is what I told her, you're not alone. You got all of us here supporting you, and she's here to share a little bit about her story with her son, her journey. Thank you.
We put him in soccer hoping he would burn a lot of that energy, but he still had plenty left over. Over the years, he was athletic in baseball, soccer, skateboarding, football, and wrestling. He also loved playing music, instruments like the violin, saxophone, guitar, and piano. Something he was really good at, and beat almost anyone he played, was a game of chess. Academically, Ernie did very well in school. He had a big heart and was so giving to others who were in more need than him. Joining the military was a family tradition for Ernie. It was something he was destined to do from an early age. After graduating in 2012 from Temecula Valley High School, he joined the Marine Corps. He wanted to see the world and be among other Marines just as his family members did. His job in the Corps was communications. While he was overseas, he made sure to check in on his little brother often. Ernie and his little brother, Vincent, had a special bond, even though there was such a big age difference. Ernie was our protector, whether he was overseas or at home. He had some struggles along the way, which led him to being released early. When he was back home, I noticed changes in his mood, sleep, and emotional well-being. One day he came to me and started banging his head on the wall, crying out to me that he couldn't get rid of the voices in his head. And so he asked me to take him to the VA for help. This was the first of 5150 holds. In the beginning of his diagnosis of bipolar and schizophrenia, he took his meds. He did pretty good. He took them. He could tell it was helping, but complained about its side effects often. He never really had ongoing therapy. It was sporadic. He wanted to be an electrician like his uncle, so he attended a trade school near the VA. That way he was close to VA classes and school. He was living on his own with my support. He would always mention being most comfortable around others like him at the VA, so I did everything I could to keep him close to treatment and school. There came a time when I think he thought he could get better on his own, so he started self-medicating. At this time, I was aware of his marijuana use, and then later came meth. Unfortunately, there were multiple 5150, 5250 holds, and incarcerations. With his dual diagnosis, it was hard for him to keep a job, keep good friends, and be independent. He would want to be alone rather than be social. His depression got worse each day. And so when the VA didn't work out, I felt hopeless and so lost, not knowing where my son was going to get the help he so badly needed. So I brought him back home to live with us when he was unable to make choices for himself. He ran into many encounters with law enforcement, but when I would talk to them about Ernie, they knew he was a good person who needed help. One of them told me Ernie always waved and smiled at them when others would run. They soon realized his struggles with mental health and substance abuse. And like Alicia had mentioned, the special team called the CBAT team at Riverside Sheriff Station put me in contact with Riverside Mental Health and put me in contact with the Riverside Mental Health family advocates during one of his last times he was detained. I finally felt like help was on its way for him and myself and our family. With the help from the family advocates, Ernie was offered mental health court. Ernie always mentioned to me that everyone on his team at the Riverside Mental Health really made him feel like they genuinely wanted to help him. When he made that comment when he was clear and medicated. And he knew he had a lot of work to put in towards it, and he was just starting to engage in the programs available for people like him. He was on his way to something better until fentanyl took him from me. People are dying every day from fentanyl, whether it's a pill unknowingly or whether it's someone who is just plain and simply addicted to it. Because that's what's available on our streets and on social media now. It's so easy to get. I feel there needs to be more education and awareness at an early age. And so I hope that we can all talk to our friends and family, coworkers, neighbors about this lethal drug, because my son was sick. He didn't want to die, but fentanyl killed him. So on behalf of myself, Ernie, and our family, we would like to thank the Riverside Behavioral Health, especially Alicia Mosillo, Willard, and Terry for giving us hope during our time of need.
So tonight, I want to make sure that we cover and answer these particular 4 questions. What is the problem? Why is fentanyl so deadly? And why are so many people dying? And how do opioids, including fentanyl, actually cause addiction? So if we just take a look at the overdose deaths since 1980, you see that there's a slow rise going on until just about 1990, and it takes an upward trend there. But then in just the last couple of years, you see that it absolutely skyrockets. The New York Times reported just this month that after a catastrophic increase in 2020, in 2021, there was another record-breaking increase to an estimated 108,000 overdose deaths in just the 1 year. And this is all part of the ever-worsening fentanyl crisis. In fact, the Riverside County produced a committee to combat fentanyl abuse. I know you can't see much of that, but in July 2021, they started a fentanyl abuse awareness campaign. And many of you saw just last week in the headlines that a bus driver from a local school was accused of giving out fentanyl to students at this special needs school. I don't know how much worse it can get. So let's talk a little bit about why is fentanyl so deadly. The biggest problem here is that it is so much more potent. It's simply stronger than almost all the other opioid pain medications on the market. And that simply means that it takes much less of fentanyl to get the same effect. Even a slight mistake in the manufacturing or in the intake can lead to an overdose and death. So how does fentanyl compare to heroin regarding a potentially deadly dose? Well, I want you to take a look at this picture of two identical vials, one that contains a potentially lethal dose of heroin and one that contains a potentially lethal dose of fentanyl. You can barely even see the fentanyl. If you change this to comparing it to a simple penny, the same amount you saw in that vial is right there next to the penny. And if we zoom in on that, those few crystals, if we gathered them together, would just about cover only the date on that penny. And that's a potentially lethal dose. I keep saying potentially because, of course, it depends on the person, their tolerance, how much they've been using, all of that stuff. But this is a potentially lethal dose. So, but then why are so many people dying of it? Fentanyl's been around for a long time. It's actually a very useful prescribed medication in particular circumstances. But why has it changed? Why are so many people dying now? It's cheap and it's profitable for the dealers. As a result, they're putting it in everything. So there are people who are intentionally trying to buy fentanyl. But there are lots of people who think that they're buying heroin, or they're buying Norcos, or Vicodin, or any of the other opiate pain medications. And sometimes when people think that they're buying cocaine, or PCP, or Xanax, it's actually either completely fentanyl or at least partially fentanyl. In Alaska, pretty far out, very rural state, of the 140 fentanyl overdose deaths that were recorded, 60% also involved meth, and 30% involved heroin. All right, why am I suddenly talking about meth and heroin? Again, because people are either using more than one thing, or it's in everything. Fentanyl is showing up in all sorts of drugs. That people think they're buying one drug, but they're actually buying at least some fentanyl. Dealers are adding fentanyl to these other drugs in order to boost the high. So they are selling, let's say you think you're buying 2 milligrams of Xanax. You're actually buying 1 milligram of Xanax and a tiny little bit of fentanyl. The dealer gets to charge you for 2 milligrams of Xanax and a couple of pennies worth of the fentanyl. So they use it to boost the high, But that means a lot of people don't even know that they're taking fentanyl. They're adding fentanyl to all of these other street drugs. If you're using any sort of drug that's not from a legitimate source, it's not, you didn't directly get it from a pharmacy. You may think that your friend is giving you one of their Xanax or giving you one of their Norcos. But that person bought it from somebody else, not from a pharmacy, and they may not even know, as your friend, that they're accidentally giving you fentanyl. So I want to real quick review the answers to that. Why are so many people dying? Simply, it's so much more potent, and because it's now in everything. It's all over the place. In fact, the Riverside County District Attorney's Office started making these bumper stickers. What's in your pills? Fentanyl kills. To simply get the idea out there that just because you don't think you're using fentanyl doesn't mean you're not getting it. It could be in anything you got your hands on. It wasn't directly from a pharmacy. So what is this stuff? What is fentanyl? It is simply an opioid pain medication. Chemically very, very similar to opium, morphine, heroin, Demerol, all of these. And an opioid is simply any pain-relieving chemical that's related to the extract from the opium poppy flower. Yeah, I'm serious, flowers. A poppy flower. Now, this is not the poppies that are in your backyard or your neighbor's garden. Opium poppies are not randomly in people's backyards, don't worry. It's a very specific kind of poppy. And as you might gather, they don't sell it in the seed section at Lowe's. But this is an opium farmer. They wait until the seed buds, the flower buds of the opium poppy are full. They cut small slits in the side, and you can see the sap oozing out of the side. That's what gets collected, turned into opium, and then can be turned into all these other opioid pain medications. Some of you may even be as old as me and remember this image. From the movie The Wizard of Oz, our heroes are on their way to stop the Wicked Witch's work, and she needs to slow them down. And you may remember her screaming, "Poppies, poppies will put them to sleep." It's a direct reference to opium poppies. That's the only reason why poppies are mentioned in that scene. And when the book was published, there was a very big opium trade around the world. So fentanyl is nothing more than an opioid, but why is it so common now? Again, because the dealers found it as a cheap and easy way, but now they make it from chemicals not from the opium flower. They don't need the opium from poppies anymore. They can make it from chemicals that you can buy from scientific labs around the world. They simply don't need the poppies anymore, and they start with a raw chemical. The most common one is Peperidin. Who cares? Peperidin, what is that? Well, it turns out Peperidin is a non-opioid chemical. It's part of the reason why it's legally and freely sold. And it's used in all sorts of chemical processes, including the ones you see here. And the last one that you notice there is making non-opioid medications. There are lots of them. Peperidin is part of the chemical processing and development of all these different medications. You may recognize a few of them here, including Paxil and Ritalin. It's also involved in making these other medications, including some of our antipsychotics. One of the most common ones a lot of you have heard of is Risperdal. Peperidin is one of the base chemicals that's used to create all these other different compounds. But then again, it's also used in manufacturing these other opioid pain medications that are prescriptions. Fentanyl, of course, is what we're talking about tonight. but I also want to show you that it's involved in making Imodium. Yeah, the diarrhea medication. Imodium, loperamide, is actually an opioid chemical. And if you want, I can explain later why that's sold freely at the pharmacy and all that kind of stuff. But it is actually an opioid chemical. So an opioid blocks the pain signals going to the brain. Well, that's a good thing. The chemical also activates the reward system of your brain, and so it makes the experience of taking this chemical feel good. But then this is a chemical to which we can become tolerant, meaning you need to take more and more and more over time to get the same effect. That's no longer good. We've got a problem going at that point. But in addition to all that, opioid chemicals suppress the signals to breathe. Yeah, that's bad. This is what causes people to die from an opioid overdose, whether it's fentanyl or any other opioid. By stopping the signal to breathe, your body just quits doing it. And if you're already asleep from the other effects of the opioid, you don't even know that you've stopped breathing. Now, one of the important things about this is that this is a chemical, all the opioids are chemicals that can be blocked by another medication called Naloxone. You're going to hear a lot more about that in a few minutes. That's a good thing. So, now we start the science class. So, first of all, I want you to relax. Don't worry. The exam at the end will only determine your cost for tonight's presentation. No, really. There's going to be a lot of science in just a couple of minutes, but we're going to go through it piece by piece. You're not going to have any problem with it. So, how do the opioid chemicals become addictive? All right, so this is an image of a brain. Just to make sure we're all oriented, if we took my head and sliced it this way and turned me this way, you're looking from my left, that's what my brain would look like. Well, mine would be smaller. So, a couple of things. This particular little orange dot is called the ventral tegmental area, or simply VTA. And I'll explain in a moment why that's important. But when that is activated, it throws a neurotransmitter chemical called dopamine onto this one called the nucleus accumbens, or NA. Why is all that important? Because the nucleus accumbens is your pleasure center. Anything that activates the nucleus accumbens will make you feel good and like you want to do that thing again, whatever it is. It could be gambling, it could be a fantastic steak dinner, or it could be fentanyl. They all use the same pathway. The nucleus accumbens then sends signals out to your prefrontal cortex, this area up here. This is where you make decisions. This is where you make judgments. And this is where you decide what you're going to do next. Well, if I activate your nucleus accumbens really big, I light it up really big, those signals to your prefrontal cortex will tell you, we have to do that again. But I'm hungry, I haven't eaten today. Doesn't matter, we're going to do that again. But I haven't had any what? Doesn't matter, we're going to do that again. It hijacks all of your decision making. So, anything that is highly activating to the nucleus accumbens can result in addictive behavior. Now, that doesn't mean it will for everybody, but for a certain percentage it will. You've seen some people go to a casino and they play for a little while and they're done. Me, I take $20, I lose it, and I'm really upset that I lost $20. Even if I went up a couple $100 in between, if I end up with my $20 gone, I had a bad day. I'm not a good gambler. The casinos don't like me. For me, that doesn't happen to be addictive. It doesn't light up my nucleus accumbens. My fear of the loss is much greater than my activation of the nucleus accumbens. So people are different as to what's going to light it up really big, but if it lights up really big, you're liable to end up in trouble. Okay, so we talked about the VTA, dumps dopamine onto the nucleus accumbens, sends signals to the prefrontal cortex. We okay? Questions about that so far? Yeah, pretty straightforward. So, how do the opioids, including fentanyl, come into this picture? They directly activate the ventral tegmental area. And once that happens, what else happens next? The whole rest of the cycle. Okay? So, what in the world do we do? Oh, one other thing. In addition to lighting up the VTA, we mentioned, they stop the signal to breathe. Now that's only if you get a very high dose. A lot of us have taken Norco or Vicodin or something else along the way, and it didn't stop our signal to breathe. But if you get too much of any of these opioids, it will also stop your signal to breathe. But we can block all this right here, right before it activates the ventral tegmental area. We can block that with a medication called Naloxone. Some of you have heard about this. The most common brand name is Narcan. But you can see why this is such an important step, why this chemical is so important to have around, where there are people who might be using any of the opioids, but especially including fentanyl. All right, honestly, that's it. That's all the science you need. Any questions about that cycle? You don't need to remember the names of the brain areas, but if you can remember just a little bit of that picture, you'll have an understanding of how this whole cycle works. And of course, too much opioid stops breathing, and you end up dead. All right, so how do you save a person who's overdosing on an opioid like fentanyl? We give naloxone to restart the breathing signal. It's that easy to save a life. So before we go on with second presenter, who should be arriving just any moment now, what questions about what we've talked about so far tonight? Yes?
I had heard that for the Narcan you don't have to have a prescription. Is that true? I went to Sam's to ask and they told me I could get a standing order, a standing sign. It was like $144.
Right. To get Narcan, you do not have to have a prescription. That is correct. California is certainly out in front on this, but a lot of states, you do not have to have a prescription to get Narcan. And that only makes sense. I mean, if you needed a prescription to have Narcan, it would be of no use. We have to have it out in the community for it to work. Nowadays, most police departments are carrying Narcan, in addition to, of course, all the EMS units. A lot of different staff from RUHS Behavioral Health have Narcan. Nope, there's one right back there, tied. Good. Because we don't know when we're going to end up in front of an overdose. Let me go back, I didn't mean to hit that. What other questions about what we've talked about so far? Really?
Is it more expensive than the drug itself?
You have a question now?
So yeah, Narcan is more expensive than the drug itself. But there are lots of ways that can be handled. Just like with any medication. How many of us walk into Walgreens and say, you know, I have this prescription for an antibiotic, I just want to pay the full retail cost. I don't want to use my insurance. Very few of us do that.
We have a question right here.
Oh, yes.
Como que el fentanilo causa cuando la gente fallece que deja de respirar.
So fentanyl causes that someone to stop breathing when they use it? Does fentanyl cause for someone to stop breathing when they use it?
Y por eso muere.
And is that why they die?
Yes, the fentanyl or any other opioid medication, the fentanyl, Norco, Vicodin, methadone, any of those, if it's a very high amount for that person, it can cause their breathing to stop. Yes, the fentanyl effect of causing you to stop breathing, yes, that is how they die.
Which organs does it damage?
None of the organ damage is what causes the death. The stopping the brain's signal to breathe is what causes death. But I'm not sure if I answered your question.
So they suffocate? Do they stop breathing and that's the cause of death?
Right. They suffocate because their brain has just stopped wanting to breathe.
So then they stop breathing and then they die.
That's right. That's right. Somebody who's overdosing on fentanyl or any of the opioid chemicals, if it's way too much, it can cause them to just stop breathing. And then, of course, they will eventually die in the next few minutes. Yeah.
What would be the symptoms when they stop breathing? How would I be able to know?
Now, we're going to go over that a little bit more with the next presenter. But basically, you will see that their chest is no longer rising and falling. Their lips will become blue. You can literally, put your hand in front of their mouth and nose. But if you suspect any of this, you can use Naloxone, the brand name Narcan. And if they're not overdosing on an opioid, the Narcan will not hurt them. You can't do any damage by giving the Naloxone.
¿Cómo se puede uno dar cuenta de que una persona está sufriendo eso?
What I would like to know is how would I be able to know that someone is suffering from an overdose?
The easiest answer is you don't have to know. If you have any suspicion, if you simply can't wake them up, you can use the Narcan while you're calling 911. If it was because of an overdose of an opioid, you may well save their life, but you have 911 already on the way for that or any other reason that you can't wake them up.
Pero si, o sea que todo transcurre como en un sueño, o sea cuando están dormidos, no se puede uno dar cuenta antes de que ellos estén así como dormidos, de que ellos están sufriendo de una sobredosis.
So this all happens while they're sleeping. If they're sleeping, I wouldn't be able to see. I wouldn't be able to see that they have stopped breathing.
Well, I mean, you might notice that their chest is no longer moving, their lips turn blue, but if you cannot wake them up, that's as much reason as you need to go ahead and give the Naloxone.
Dr. Wygold, I think that what she's trying to get to is that that when they're doing the drug, I guess they're not having a seizure or something like that. That's what she wants to know.
Okay.
She'll be able to tell, like, my kid just did it. Is there a symptom before they just fall asleep and stop breathing?
Okay, thanks.
Yes. Yes, thank you. That's exactly what I was asking.
Okay.
Is there a way for me to know that someone has used before they would actually go on to sleep?
There's no good way to know before. But if somebody is asleep and you cannot wake them up, that's all the reason you need to go ahead and give the Naloxone. Now I'm going to ask if I can take a question over here real quick. If you have more, I'll certainly come back. Yes, ma'am.
Yeah, I have a question pertaining to the time frame per se. I know everyone is different with medication and the individual is different. Does the statistic indicate that the time frames, like they've used it for 2 months, 6 months, or a year? Does it say anything about that?
So, if I heard you right, you're asking about how much the length of their use,
Yes.
the amount of weeks and months that they've been using, affects whether they're going to overdose. Is that correct?
Yes, sir.
Okay, thank you. Certainly, as somebody becomes accustomed to using this or any other opioid chemical, their tolerance, how much it takes for them to get the same effect, starts to rise. But they can still overdose even if they've been using for years and years. And of course, if they didn't know that they were taking fentanyl because it's hidden in one of these other things, all bets are off. And if somebody has stopped using this or other opioid chemicals for a couple of weeks, their tolerance has dropped down. The amount that they used to use just to feel good may now suddenly be deadly. Does that help?
Yes, sir, that's great. Thank you very much.
Okay, I'll take a couple more and then we're going to switch over to our other speaker.
How much Narcan, like the nasal, how much is it safe to use?
It's okay. It's a single dose. We're going to explain all that in just a couple minutes. The how to go about using it, the reasons why it's the thing to use. But thank you. There was one more question over here. Yes.
So sometimes when you're working with the families and the clients, right, and there's a dual diagnosis. I think there's a misconception of, oh, okay, they're using a lot of Xanax. You can't use Narcan in it. But I guess now with what you're saying, they should, because we don't know if that Xanax has been laced with fentanyl.
Well, that's right. One of the things that has changed in the picture. I'm sorry. Let me restate your question. See if I got it right. There has previously been the thought that I don't need Narcan around because my family member uses Xanax or uses alcohol or uses heroin, not fentanyl. So I don't need Narcan around. And you're asking if now that has changed because it's in everything. Am I right?
Right.
Yeah. And so yes, this is a big part of what's changed the picture. Because it's in all kinds of things. And so many people are dying of fentanyl overdose and they have no idea that they took fentanyl. They did not intentionally take fentanyl. They thought they were taking cocaine, PCP, Xanax, all kinds of things. Okay, so I'm going to stop right here and have our next presenter introduced. Thank you.
My name is Niyati. I'm one of the pharmacists and I work at the Arlington campus that's close by here. So I wanted to mainly go over Narcan. So the main things that I wanted to go over are listed here. I tried to make the slides as comprehensive as I could so that nobody has to write anything down and that if you wanted to reference it, you know exactly where I got the information from. And then all these, everything that I put together, it's also on like the CDC, FDA websites, and there's handouts there. So if you wanted to print anything out, whether it's for yourselves, for other loved ones, then you definitely can. So I know some of this you might have already gone over with Dr. Wygold, so I'm sorry that if you have to hear it again, just let me know. Just nod your head and I'll kind of like skip through it. So the main things I wanted to go over is first, like, what is Narcan? I know, has anyone heard of the medication? Okay, so that's the main one that we're going over. I want to go over how does it work to prevent an opioid overdose, why everyone should carry it. So it's not just people who have like a problem with opioids, so like oxycodone, fentanyl, heroin, but also any loved ones that might know someone that basically has like an opioid prescription. Because even if you got your wisdom teeth removed and you have an opioid prescription, it's still nice to have Narcan in the house. So that's one of the things. And because we're talking about everyone carrying Narcan, I do want to go over some of the legal issues that sometimes people are afraid of, because they're like, oh, okay, why should I be carrying it, and will I get in trouble if I administer it to a bystander? And then also, what are some of the signs and symptoms? So what are we looking for and how do we know when to administer Narcan? How do you use it? Because that's one of the biggest things. It actually comes as different supplies, so it can come as a single-use nasal injection, or it can also come as one that you actually have to put together before you administer it. And then there's also an actual injection, but the two that you're going to see are the nasal forms. And then the last part I wanted to go over is how do you actually dispose of medications? So this is a question we get in the pharmacy a lot, and especially with opioids. So if anyone gets any sort of surgery, many times you're prescribed like oxycodone, Vicodin, Norco, anything like that. And the biggest thing is we keep it in our supply or medicine cabinet. We don't really get rid of it. We're like, oh, maybe we'll need it another day, or maybe someone else will need it and we'll like give it to them. Well, don't do that. I know everyone already knows that, but if you look at the statistics, there's a lot of people that end up starting opioids because they got it from someone's house. It's very easy to go in, grab it, take something, and you might not even know what it is, or you'll be like, oh, it's okay, maybe it won't hurt me right now, but then you end up having an addiction problem. And so one of the biggest things we're gonna go over is where do you throw it away? And it's usually not the pharmacy, but everyone always thinks the pharmacy. Everyone always brings us a bag of medications. I'm like, I don't know what to do with this. So the first thing is, what is Narcan? So if you look here, these are the two products that you're most likely gonna see. Has anyone seen these products before? Okay, what do you guys see more, the top one or the bottom one?
The bottom one.
The bottom one? Okay, that's good. So right now, you can either see both. So it depends on the pharmacy. Some pharmacies have a contract with where they get the top one, which is a little harder because when you're like frantic and you have to put it together, if you don't know how to put it together, you're just gonna be more frantic. The bottom one's the easier one, and that's the one that mostly the pharmacies here is what I've seen that they carry. So, like we know, naloxone is an opioid antagonist. Basically what that means is it reverses an overdose of opioids. So whether that's fentanyl, heroin, oxycodone, anything like that. And what we're going to talk about is just the two nasal sprays. So how does it work? You might have already gone over this, but basically in the brain there's receptors, and if that's the oxycodone's going to the brain, hitting the receptors, and then starting to help with pain, right? But then one of the side effects is the shallow breathing. So if you take too much, it causes your brain to like lower how to breathe. So when that happens, when you give naloxone, it blocks those receptors, so it doesn't allow the actual oxycodone or the heroin or anything to work. What's nice to know about this is that it helps restore breathing in 2 to 3 minutes. So right when you give it, you wouldn't expect the person to wake up right away. It just takes a slight bit of time, and in a frantic situation, 2 to 3 minutes seems like a long time. And another big point is it works for 20 to 90 minutes. And the reason that's important is because of the next slide. So you might need more doses. So naloxone only works for 20 to 90 minutes, but something like fentanyl stays in your body for 72 hours. So just that alone, you need a lot more naloxone to help with. So basically what happens is, say you administer Narcan for someone. So in 20 minutes, they'll wake up, and after that, they might start getting drowsy again. So you're like, oh, what happened? I just administered it. Why is the person getting drowsy again? And that's because the naloxone stopped working because it's only in your body for a short amount of time. And that means that you have to administer another dose. And someone had a question earlier about how many times can you give Narcan? So sometimes you have to give Narcan multiple times. So I went to school and did most of my studies on the East Coast. And if you guys know, the East Coast has a lot more like a bigger problem with the opioid epidemic. Compared to here, what you hear about more is about meth. But on the East Coast, you hear a lot more about oxycodone, heroin, fentanyl. And so over there, if you're giving Narcan and you have to end up giving another dose, you can. So basically, you keep doing it and you keep giving Narcan until the patient's like responsive. The thing is, Narcan doesn't hurt anybody. And there's laws protecting you for administering it. So why carry Narcan? If you guys didn't know already, it saves lives. Whether you're saving someone that you know, someone that you saw on the street, and it has low risk. So that's why we want to try and get everyone to carry Narcan. And like I said, naloxone is very safe. And it doesn't have an effect on other medications. So say someone drank too much alcohol and you administer Narcan, basically nothing would happen. It's not like you're helping them, but you're not harming them as well, which is important to know. It can also be administered in pregnant women. So if you saw someone who's pregnant and you suspect an overdose, you can still administer it. But the thing that worries people is when you give Narcan, it leads to an opioid withdrawal. So basically what that means is once you administer the Narcan, the person might end up looking a little bit more agitated than they were initially. So here's like a symptom. So basically what withdrawal looks like is after you've administered the Narcan, someone might be a little bit more sensitive to touch. They'll seem like they're a little bit more irritated, and that's because you're switching everything that the opioid was doing, and so now they'll feel even worse, so they might be more angry when they're alert. They can have nausea, vomiting, diarrhea, and they can feel unwell. But the biggest thing to remember is that all of these are temporary and not life-threatening. So even though they're experiencing a really bad time and it looks like they're having more pain than they were in before, it's something that you still want to administer. Do you guys have any questions right now? Okay. So this slide goes over all of the states that are in blue have laws protecting you against if you administer Narcan. So that's basically like all the states. And what do they protect you against? So there's laws that prevent you from getting arrested, charged, or prosecuted if you basically help someone administer Narcan, if you yourself have any drugs on you, if you have any drug paraphernalia on you, you can't be charged, prosecuted, or arrested. In California. I don't know about all the other states. So now goes into what you're actually looking for. So if someone has an overdose or you suspect an overdose, this is what you would see. One is small pupils. So that's the first thing that you would look for. So if their eyes are dilated, then they might have taken a different substance. They're falling asleep or they're losing consciousness. So it doesn't mean that the person has to be fully unconscious, even if they're like kind of getting drowsy, it's still something that you can administer. They will have slow, shallow, or weak breathing. So that's something you definitely have to check for before you administer Narcan. They might be making something like a choking or gurgling sound. They'll look cold, clammy, and they might have blue skin or nails. So this is what you look for before you administer Narcan. And then the main things you're supposed to do is first you're supposed to shout, try and get someone else's attention because you want to try and get someone to call 911, whether that's you or you're getting somebody else to do it. Then you administer the Narcan and you stay with the patient or the person, and then you would start CPR and then you would assess it. So the main one we're focusing on is now how to administer the Narcan. But before I do that, I want to tell you where to get Narcan. So has anyone actually purchased Narcan before? No? Nobody? Yeah? Okay, was it difficult to get from the pharmacy?
No, it wasn't. It was actually kinder.
Okay.
Yeah.
Okay, so I don't know if you guys knew, but pharmacies carry Narcan, and you don't need a prescription from the doctor to get it. So that's one of the biggest things. So if you walked in and you're like, oh, I need a prescription for Narcan, they would be able to give it to you in California.
Has that always been the case? Because I did tell Dr. Wygold. I went to Sam's Club and they told me I needed a standing prescription, standing order or something to get it.
No, so that...
But that was like almost maybe a year ago or something.
No, this has been around for like at least like the last 5 years or so. The thing is, if they tell you that, you can... So I actually put like... So this is from 2018 and for California pharmacists. So you could even like bring them that and be like, well, it says here that pharmacists are allowed to dispense it.
Oh, okay. I know it was expensive. I think it was like $144.
So Medi-Cal covers it. It depends on what insurance it is, but they'd be able to process a claim just to check to see if your insurance covers it. And so how they cover it is they do like a 1-day supply. So then say you needed it again later, you can come back and still get like another Narcan. And so the one part about this that gets kind of tricky and people feel weird about is that say you're getting it for somebody else, like you want to carry it for yourself, pharmacists still have to put it into the system. So they'd still have to put it in under your account. So they'd still ask for your name, your date of birth. So people sometimes get hesitant to be like, why, it's not for me. And they'll put in the directions to be like, administer like as needed, but it's still in your account, which people get weary about, but it really doesn't mean anything. It just means that you got Narcan.
Yeah, and I think I heard about it only because, I don't know if I heard it on the radio or I had read that anybody that is going through like recovery, because our son, we used to buy Xanax off the street.
Yeah.
You should always have it. And that's why I had gone to ask, but I couldn't get it, you know.
No.
But it's always been something, like the Dr. Wygold said, to have on hand.
Yeah, and we actually started doing that. So at the psych hospital that we work at, or that I work at, they, for any patient that came in, and if they did a drug test where they were positive for meth, benzos, oxycodone, anything, we still gave them Narcan when they were leaving, just in case. And so then, as a pharmacist, we'd still counsel them to be like, hey, we're doing this, we're just giving it to you just in case, whether you use it for yourself, you use it for somebody else, and then we give them all the paperwork that goes with it.
So is that always? Because the time that our son was on, they tested him, and he's always came out positive for benzos back then. Never gave
No, this was more recent. Because we were trying to...
They never gave him anything.
Yeah.
Okay.
Yeah, it's because we started getting more Narcan, and since we were the ones writing the prescriptions, we're like, why aren't we doing this? So we tried to do it as a side project, just to be like, okay, everyone can have it, and it goes through the insurance. So this way, like, people have it on them. Some people will still refuse it and be like, no, I don't want it. That's like up to them, but at least this way we can offer it.
Oh, okay, thank you.
Yeah. So if anyone gives you a hard time, like, this has the information on there. So.
Okay, thank you.
Yeah. So like I said, these are the two products. So this one is just the one-time nasal spray, which is the one that you guys have mainly seen. And then this one's the one that you have to put together. So it comes in the kit, and then I'll show you how you're supposed to put it together. So what you're supposed to do, if you have the Narcan nasal spray, that's just a one-time dose, you're supposed to tilt the person's head back, you're supposed to support their head, and then you're supposed to spray it in one nostril. So you don't have to spray like half of it and then spray the other half, because that's what you have to do for the other one. So you just press firmly, and then if there's no response in 2 to 3 minutes, you do another dose. And the little kit comes with 2. Do you have any questions about how to administer this one?
I have a question. Say, for instance, if we're uncertain and the individual is in crisis, and his lips are blue, he's not breathing, could you administer 2 just to be on the safe side and wait instead of waiting the extra 2 to 3 minutes?
So it gets kind of, so they say to wait because if you give it all, you're going to reverse all the opioids really quickly. So now they're going to feel really agitated, unwell. So that's why they give you the 2 wait time. So as you're supposed to do it, you're just supposed to wait, just because if you do it all at once, then you might make them like unwell faster. Yeah. And it's because you have the second one on you so that you know what to do after if they're not breathing. And it's not going to make it work like how it works is it still takes a while to absorb, so even if you did 2 at the same time, you'd still have to wait the 2 to 3 minutes, unfortunately. Because it still has to travel and get to the bloodstream. And then this is the second one. So this is what comes in the kit. You have this little plunger, you have the actual medication, and then you have the little piece at the end that goes into the nostril. So when you're supposed to open it, basically all the colored pieces you're supposed to take off. So you take off both yellow pieces, the red as well, and then that's when you have all your pieces that are ready to go. So when you take off the plunger, you're supposed to put the little red piece and you're supposed to twist it in the end, and then put the nasal piece in the front. And so then that's when you have it ready to go. The only difference about this one is that you're supposed to spray half of it into each nostril. This one you don't see as often because they came up with the other one, but just in case you see it, you know how to use it. And you can always ask for the other one. The only way they wouldn't do it is if your insurance only has one on formulary, and then they'll only cover that one. And that's when you'd end up with this one. But Medi-Cal covers the other one, so I'm assuming a lot of other insurances cover it as well. And then this is a big thing, like I mentioned, to dispose of your medications. Anywhere you go, they give you opioids relatively easily. I just had my wisdom teeth removed and they automatically are like, do you want Vicodin or Narco or what do you want? So make sure you throw them away or keep them in a store cabinet. Don't just throw them in the trash, but this website, if you actually go on it, it tells you where there's different drug disposal areas. And one of the easiest places to go is a police station. The police station is supposed to have a bin where you're supposed to dispose of unused medications. Pharmacies, some of them have it, but most pharmacies don't. So when you take your meds there, they're like, we don't know what to do with it. And then this is a list of everything that I've used in case you wanted to go back to it. Questions?
I have one last question. I noticed the Narcan has 4 ounces or 4 milligrams of what is it, liquid or, okay? What is the 3-step volume versus the Narcan of 4 milligrams?
Yeah, that's a good question. They actually made that, so that one's actually lower. And that's just because that one's the one that was made first. It's with the 2 milligrams per 2 mLs. And then the other one's the 4 milligrams.
So, okay, that's 4 milligrams, and then the number 2 is how many milligrams?
2 milligrams?
2 milligrams.
Yeah, because they'll have 2 mLs in it, and so each one is 1.
Now the other question, you mentioned, milligram per nostril. What is the difference between applying, like you said, 1 nostril spray versus the 2 nostril spray?
That's a good question. Honestly, I don't know. That's how the company came up with it.
This is why I was saying that how do we know? Because if the individual, the loved one, is really out of it, and say for instance, you're putting less in number 2 and more in number 1, I mean, I don't understand how you can equate, what reaction the body's going to take. Why are we doing, less in one and then more in another one? Yet, if the loved one is dying, then we wait 2 minutes and we might wait too long.
No, that's a very valid question. The only way I can explain it is that different manufacturers made it, and they do their own studies. So whenever they make a medication, they have to do their own study, and they basically tell us how they're supposed to do, how they conducted their study, and how they did it, so that we can basically educate the same way. We can call them, but that's the best I can give you.
Yeah. Did I see, so when you administer the Narcan, did I see where it said you administer CPR?
Yeah.
So you administer the Narcan and then you start the CPR?
And then you start the CPR right away.
So that might work with what you're talking, because that 2 minutes, because you're administering CPR.
Well, the reason why I'm saying this, because I had our son go through that crisis, and unfortunately the sheriffs were unable to sort of react, because the sheriff that was there, my son's lips were blue, and the sheriff didn't know, and I heard them talking. They said, should we get the nasal spray? But they were decisive on that action, and yet another officer came and he was just shaking him, and that what sort of woke him up. But this is what I'm saying, what decision, or how do we know? Because it looked like the sheriffs were questioning whether the spray was going to work or not, because they were asking, they were unsure of the product itself, because they were asking what he took, and my wife telling them, it's Xanax, but again, no one knows. I'm not even thinking that, I don't even know if he was taking Xanax. It could have been fentanyl, but his lips were blue. I saw him, he was in the back of our truck, and it caught me by surprise. It taught me something that even the sheriffs are not aware of what to do, because they look confused. The woman sheriff was getting emotional, which I was sort of like shocked. These are the sheriff department. And it took somebody else to come in and sort of like pull them out and shake them because they didn't know what to do.
No, that's a really valid question. I don't know if Dr. Wygold knows, but if not, I can definitely call the company and try and see if they have more guidance.
And I know my son's a strong kid, you know, because I know he takes a lot, and he was taking a lot of Xanax, and see, they didn't know. And so this is what I'm saying, that how do we know that, say for instance, an individual overdoses on the Xanax and you notice the lips are blue, you know, the decision to put 4 milligrams of spray and not wake them up, because the officers couldn't wake them up. It took minutes, there were minutes that went by, and 20 minutes that he could have died that evening. But it didn't, so now thinking of other individuals that were not so strong an immune system or weaker body system that can die. You know, I'm confused because why there's less milligrams of that. Even if it's a two-stepper, I can understand that, but you know, to administer half.
No, that logic makes that makes a lot of sense.
This is the confusion. It's only a confusion.
No. Honestly, I haven't even thought about. So this is like a good question that you brought up, and if you give me your information after, I can find out and let you know.
Okay. And this is because if I see it on the street, you know, I want to even assist and help somebody I want to spread the news out there, what we're learning, because the epidemic is bad. It really is bad, and some of us have seen it. We've gone through it, and I had an honor and a privilege to work a job that I had to work on the outside, where I interacted quite a bit with homelessness, and I saw it. I saw it on a daily, if not daily, every other day. I saw kids. These are kids that are ODing in riverbeds. But again, unknowing the circumstances, they could be violent, or there could be other people, you know, watching that can react, and you know, so it's sort of like you have to be on guard. But for God's sake, the way I look at it, it's a human, it's life, you know. So the confusion, getting back to the product, is
I'd like to throw in real quick. I mean, she said it may have to do with exactly how they did the research. Because these are two different types of sprayers, it may have to do with the exact construction of the sprayer itself. And so in order to get enough Narcan into the system, the one that's more difficult to put together may be able to spray further back and get to more blood vessels. And so you don't need as much Narcan to get the same effect. It could be that simple. But we can absolutely look into this and get the information back to Pedro so we can get it out to everybody.
Okay, fair enough. Thank you.
Because that's definitely something. Like, now that you brought it up, like, I need to know, because why wouldn't you? That makes sense. That makes sense.
I was going to say the same thing as the doctor said.
Yeah.
I'm a nurse, so I'm an ICU nurse, and we have this type of thing, and I was going to say the same thing, that it could be the way that it's administered. Also, are the milligrams and mLs the same on each one of those?
No.
Because I know, so is it 2-to-1? Is it 1-to-1, or is it?
So this one's 1-to-1, and it comes as a 2 milligram, or 2 milligrams per 2 ml. And then this one's 4 milligrams and 1 ml.
And you give half, so on the 2 ml, you give half, so half of that would just be 1 ml per
Yeah, so you give 1 ml per nostril, yeah. And for this one, you give the full 1 ml.
Yeah.
So it could be that your nostril can only take up 1 ml of a spray. But then you had the other point of like, why wouldn't we do the 4 milligrams in both? And that would just be 1 ml each, so that's, yeah.
Are they manufactured by the same company?
No, they're manufactured, that was my other thing. They're manufactured by different people. And so basically they do their own studies. So it's like, and it gets hard. So I've called pharma companies a lot for lots of different medications, because a lot of things, when we get questions, it's easier to ask them if they've done extra research. The hard part is they'll be like, this is how we studied it. So they can't give us a definite answer, because they'll be like, this is how we studied it. And so then it makes it harder on us, because it's like, these are all other valid questions, but it's like, this is how they studied it. So it's like, we can't defer from basically what the evidence or the information that we have.
But could it be that because of unknown factors, so they may not know what the person had taken or whatever, so, you know, I would think that they don't know, you know, have the information if it was this, that, or the other. So you gotta be very careful with that because you can go to one spectrum to the other end if you don't know, you're not aware.
Yeah. No, that makes sense too. Thank you for everyone else's input.
She has a question.
Yeah.
Quisiera, si ella me puede decir, estoy escuchando que algunas drogas están mezcladas con el fentanilo. ¿Qué efecto tienen cuando se lo tragan?
So I'm hearing that some drugs are mixed with fentanyl. I would like to know what are the side effects when people take these drugs?
When they take fentanyl?
Cuando se lo, o sea, mi hijo era adicto y él estaba en un centro de rehabilitación y él consiguió tanto, no sé si yo lo que sabía que estaba en la cristal, pero como mirando que se puede entender esa droga.
So my concern is because my son used crystal, and I would like to know, how would I know when the crystal that he's used contains fentanyl and when it doesn't?
You can't.
Oh no, you got the microphone now.
Because this one occasion he was, okay, so he was at a rehab center, and so that he wouldn't be catch using it, he swallowed it. He swallowed the crystal.
Okay. So I guess the best way to describe it is you can't tell just by looking at it if something has fentanyl in it. You can tell by the reaction that it might have. So if someone ended up taking too much of something, they would be displaying these symptoms. And if they are displaying any of these symptoms, then it means that most likely what they took was an opioid. So whether it was fentanyl or oxycodone or heroin or what was mixed in it, they would display these symptoms if they took too much.
Yo no pude mirar porque él estaba en un centro medical y cuando solo nos dijeron y lo tenían, cuando ellos recaen los tienen aislados y después del tiempo él salió y murió, se fue a dormir.
So I wasn't able to see him because he was at the rehab center. But then after when he was released, he fell asleep and he died.
Fue doctor porque se sentía mal y le dijeron que cada vez se levantaba.
He went to the doctors, because he wasn't feeling good, he was told he was dehydrated, thank you. And then they told him to
So the one...
Yeah, and the doctor told him to go home.
I'm sorry.
And then he passed away.
I get...
He fell asleep and he passed away.
That could have been something else, I'm not sure, but if someone had overdosed on any opioid, then they would have, and they took too much, they'd have shallow breathing and they'd probably lose consciousness. Like they wouldn't be able to be walking and talking normally.
Yeah, I didn't see him, so I don't know.
Yeah, it's kind of hard because it wouldn't be days later. It would
That's
be kind
why
of.
I'm asking, because I would like to know what actually happened.
Yeah, for that I'm sorry. I don't know.
Thank you.
Yeah, you mentioned right now, but I was going to say, one of the symptoms is slurred speech as well.
Yeah.
You know, I used to work in a rehab center, and we had an intake, and he overdosed on us, and I don't know how long it was, 10, 15 minutes, but we Narcaned him like 6 times.
Okay.
You know, 'cause we were, you know, and maybe transfer the guy's question, like, nothing happened, like, he came back, you know, we didn't see him responding, so we used like 6 Narcans on him,
Yeah.
you know. Eventually he came back, you know. I just wanted to share that.
No, that makes sense, and that kind of does go back to that point where it's like, if it's not gonna hurt, can you just give both at the same time? I want to just be like, yes, because I know if I was in that situation, I'd panic, and I can't even say I would wait the full 2 minutes. I just want to check, so if there's like concrete evidence, I can share that.
We have a lot of parents that sometimes they say that their children only use marijuana, right? They only smoke pot.
Yeah.
But nowadays you don't know. So for the families, I think it's a good idea to carry the Narcan, because you never know if they did that, what else are they going to get into? And sometimes there's stigma, or sometimes it's like, no, my kid only does this. Well, you don't know. If he already does something, he might get into something else, so prepare yourselves.
Yeah, no, that's a valid point.
Yes.
Yeah, and you can't know, like you can't tell, and a lot of even different drugs that you take, they kind of show some of this like similar responses, so it is better to be safe.
And ask Police Family Advocates, we'll figure it out, we'll get you one.
Yeah. I would just say our pharmacies now, it's different. It's like we only have an inpatient side, or else I'd just be like everyone can just come there. But yeah, if you guys need help, you can always call us and we can try and figure out a different pharmacy, or we can call them to be like, hey, can you just get this manufacturer? Can you do this? And try and help set it up. Yeah.
Is there an expiration date on those?
Yeah, that's a good question. So the expiration date's always on the box itself. So whatever the expiration date's on that, as long as you haven't opened it, that would be the expiration date.
How would you dispose of it?
So same thing. You could take it to like a police station and throw it in. That's not only for opioids. You can dispose of other medications there too. Yeah.
Right, I will say on disposing of the Narcan, if somebody says, ah, screw it, I'm just going to throw it away, it's not going to hurt anybody. If it got left out in the yard, it won't hurt my dog. So, if somebody's, if you find out somebody, oh, I just threw that away, there's no reason to be upset about that. Now, the Norcos, the OxyContin, the Vicodin, that stuff, absolutely. Don't just put that in the garbage. Don't leave it around. Don't leave it in your medicine cabinet for 12 years.
I have a question. I have access to Narcan, right? We have that. I work for mobile crisis response teams, and I work with Dr. Wygold. My question is the temperature on that. Like, so when we work in mobile crisis teams, to keep it with us, because like just being in this presentation, thank you guys for both presenting, but just being in this presentation makes me think I need to even carry it, be more aggressively at having it, because I do get to see it as well, like the gentleman in the front, So what is the temperature, and what would be the recommended part? Because we're always in a car, so do you have any recommendations?
We're always out in the field, and days, obviously, as you know, get hotter and hotter, especially when we are driving all over the county.
No, that's a good question. So it's supposed to be at room temperature. So every medication that's like we store in the shelf is supposed to be at room temperature. What happens is if you go out, what can happen to the medication is it basically disintegrates. Doesn't mean, so it would basically lose efficacy if it reaches the wrong temperatures. But there's no like, if you reach 80 degrees, for 10 minutes, will it be messed up versus if it's 75 degrees for like 10 days. So it's supposed to be at room temperature, and I guess you do the best you can to try and keep it at room temperature. But it's kind of, if you haven't and you used it, it wouldn't hurt the person, it would just not be as efficacious.
Would that too work the same way as like, so, because we get different batches of it, so we don't, like, the expiration dates are differently, so like when we're going out in the field and having one, so if we were to administer, like it expired yesterday, the efficacy would just be significantly lower. It's not like you can't do that and there's dangers, right?
Yeah, 100%. If it was expired and I needed to use it on somebody, I would use it.
Okay, because I would too. I'm with this gentleman down here. You're going to get 6 doses more. I'm gonna try to- Right? I mean, if you're coming back and you're irritated because you're coming down. off
Yeah,
the
I'm still on this question because I need it.
Right? I'd rather help you than bury you.
Yeah, no, it makes sense. And it's like, if we can give more without harming the patient, I don't see I'm trying to see like why you wouldn't do it, and I can't see a reason yet.
Thank you.
Yeah.
So it's almost to the fact, like if you have I know it's different, but if you have insulin and it expired like yesterday or 2 days, but you're in an emergency situation where your sugar was 400 or something like that, you're like, oh, this is expired, and we just wait and die. So you're just gonna give yourself insulin.
So insulin definitely after certain temperatures, it disintegrates and doesn't work. So yeah, if it was really close to the expiration date and I had to, I would. But if it's like 10 days past the expiration date, I would have been like, please just get your insulin. So insulin's just a little different because it's just not as stable. But yeah, in an emergency situation, I mean, like anything that you think would help the patient helps. Really making me think now.
So as you're asking about the expiration, I'm thinking about, the Oreo cookies in my cabinet have an expiration date. It was probably sometime in 2020. If I'm hungry, would I eat them? Sure. But dairy products, I think of differently. If that milk's been open for a week, yeah, I'm not going near it. And so insulin and Narcan, I would think of more like the Oreos versus the dairy. Does that help any?
Yes.
Now you know what I eat too much.
I'm raiding your office, Doc. Throw away all expired foods now.
All right, any other questions? All righty.
Okay, I'll find out these questions though, and I'll email Pedro. Yeah.
We have all of their emails, so we can just do one batch and send it over to them.
Okay. And if you have other questions about, I mean, any medicine-related thing, you can just message us. I don't mind calling the pharma company if I don't know.
Do I call you when I have a question?
You call all the time when I have a question.
Because they always answer my questions.
So let's give our presentation a round of applause. Thank you, doctors, for being here, and thank you for being an ally. This is very informative for our families to know, and they can go out and branch out and let other people know that are dealing with the same situations. So we really appreciate you guys.
Very welcome.
All right, let's give them one more applause.